Hi, today we'll discuss that is poliomyelitis. So first of all, we have to know what do you mean by this poliomyelitis? So poliomyelitis, that is a highly contagious viral infections or infectious disease, which is caused by poliovirus. Okay, and primarily it affect the central nervous systems, and also uh, it will lead to a paralysis. Okay, it will lead to a irreversible paralysis. Okay, it will uh, and also characterized by breathing difficulties, and also sometimes it will lead to a death. So in the under the poliomyelitis, we'll discuss definitions, causes, signs and symptoms, diagnostic evaluations, medical managements, and nursing managements, complication prevention. So let's see the definitions of a poliomyelitis. So poliomyelitis, also known as commonly known as polio. So this poliomyelitis, that is a highly contagious infectious viral disease, or highly contagious viral disease caused by poliovirus. That is caused by which virus? That is caused by poliovirus, primarily affecting the nervous systems and potentially leading to a paralysis. Okay, so next we'll see that is a causes. So here main causes, that is a transmissions. So the virus is spread primarily through the fecal routes. Okay. Transmissions, the virus is spread primarily through fecal routes obtained by contaminated foods and water through respiratory droplets. So here the types of a poliovirus. There are three types of poliovirus which is cause a poliomyelitis. That is type 1, type 2 and type 3. Next we'll move on, or we'll see that we'll see sign and symptoms. So in sign and symptoms, there will be asymptomatic sign and symptom is there, non-paralytic polio, paralytic polio. Okay, asymptomatics, most infections are asymptomatics. Non-paralytic polio, flu-like symptoms may occur, like fever, fatigue, headache will be there, nausea, stiff neck. Next, paralytic polio affect a small percentage of cases, leading to sudden onset of weakness or paralysis, muscle weakness, respiratory failure in severe cases. Next we'll see that is a diagnostic evaluation. So in diagnostic evaluations, here clinical diagnosis is in clinical diagnosis based on symptoms and history of exposure, and laboratory tests. So under the laboratory test, here isolations of poliovirus from stool, throat or cerebrospinal fluids. And next test, that is a serological test to detect the antibodies. Next we'll move on medical management. So in medical management, here no cure, focus on supportive care and symptom management. Okay, so here we'll provide pain reliefs, NSAIDs, and next physical therapy to maintain the muscle functions. In severe case, respiratory support may necessary. Okay, so these are the medical managements. And next we'll move on to, that is a nursing management. So in nursing management, here assessments. So in assessments, we have to monitor the respiratory functions, muscle strength and vital status. Next, supportive care is required. Encourage mobility and rehabilitations exercise. patients educations. We have to inform about the vaccination and prevention strategies. Next, emotional support. We have to provide psychological support for patients and families. Next is complications. So in complications, it may lead to a permanent paralysis, respiratory issues, post polio syndromes. Okay, so these are the complications. Next we'll see that is a preventions, how we can prevent the poliomyelitis. So vaccination is required. So there are two types of vaccinations, that is IPV and OPV. So these two vaccinations we have to administer for preventions.